Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about government policy and human rights. Welcome back to Policy and Rights here on Depictions Media Radio. The province of British Columbia is making it easier for internationally trained nurses to find work in BC. The healthcare system, with new financial supports and faster, more efficient assessments to the pathway towards work. Internationally educated, or IENs, will no longer be required to pay application and assessment fees up front, which cost more than $3,700. That seems a bit excessive for a person who's already been trained to have to pay. These fees will be covered directly by the province in order to remove financial barriers for internationally educated workers who want to work in British Columbia. British Columbia right now is experiencing a shortage of nurses. They were actually experiencing a shortage of nurses before the pandemic actually hit. And a lot of it is now, of course, being blamed on the fact that we had a pandemic and that we have a crisis in British Columbia with the high number of flu cases that are being seen in emergency rooms and in hospitals. But some of the things that may not have actually helped this situation was that they fired any nurse who did not become vaccinated during the pandemic. If that particular person had a problem, whether it be physical or personal, with the vaccination, they were given a deadline and then fired. Supposedly, some of those barriers are going to be reduced also in order to bring nurses back to work so that the people in the hospitals that are in the hospitals now with the flu season, and of course we still have COVID variants floating around, that they're looking to bring back nurses to help give more care and ease workloads. So let's listen to some of the announcement from Premier David Eby and Minister of Health Adrian Dix.
Campus, I haven't been here in a while, Premier. In fact, some people say I haven't been anywhere in a while, except rooms isolated in various parts of the province. So it's great to be here today. I want to acknowledge that we're on the traditional territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nation. I want to extend our gratitude, the Premier, of the government, of everyone here, to Langara College for allowing us to use their classroom for this announcement today. Langara College is one of the sites where internationally educated nurses do their triple track assessment. A single competency assessment is administered by the college's nurses and midwives and Nursing Community Assessment Service. It allows the college to identify the readiness of an IEN to work as a healthcare aide, a licensed practical nurse, or a registered nurse in British Columbia. So it's fitting for today's sequel announcement, the one we made in April, to take place here. It's always my pleasure, and it's our pleasure to share the latest news about the foundational work we're doing together, we and our partners, to support and strengthen our public healthcare system and build on our Health Human Resources Plan. So I'm going to introduce to you the people who will be speaking today. Premier David Eby will be first. Harvinder Sandhu, the Parliamentary Secretary for Senior Services and Long-Term Care, and the MLA for Vernon Monashee will be speaking. Aman Gurwal, the President of the BC Nurses Union. Good to see you, Aman. Cynthia Johansson, CEO of the British Columbia College of Nurses and Midwives. Jenny Arseno, registered nurse and internationally educated nurse, who was part of our first announcement. She did so well. We brought her back for the second time. It's incredible. I was there too. They brought me back, but they had to. That's the difference. That's the difference, Jenny. And Monique Wee, who's a registered nurse and internationally educated nurse. Nice to see you. I want to also introduce some other people who are here, in particular, Susie Chant, the MLA for North Vancouver Seymour, who's the Parliamentary Secretary for Accessibility and, of course, a registered nurse like Harvinder, so we are well represented here. As well, I want to introduce Rita Parikh, the Executive Director of the Nursing Community Assessment Service. Rita's over there. Rita, I want everybody to know, in my last job prior to being elected, succeeded me in that job. So, you know, she might be the next Minister of Health. We'll see if that pattern continues. We're so happy to see all of you in the new year. And so, as all of you know, in September of 2022, we announced our Health Human Resources Strategy, which outlines 70 actions to strengthen BC's health workforce and build a stronger healthcare system for all of us. Since I have been Minister of Health, we've added net new 38,000 new workers, doctors and nurses and healthcare assistants and health sciences professionals, and we have to do it again, and then we have to do it again. Today, I'm happy that we're launching another step in this plan, and to deliver the announcement, I'm honored to invite the Honourable David Eby, Premier of British Columbia, to the podium. Premier Eby.
Thank you very much, Minister Dix. Thank you for the kind welcome, and so glad to be joined by so many talented and remarkable British Columbians here today. Joining you today on the territory of the Musqueam people, the Squamish and Tsleil-Waututh, and I would like to take a particular moment to thank my colleagues in the legislature who are nurses joining us today. Harvinder and Susie, wonderful to see you both, and glad to see you bringing your personal experiences and professional experiences to today's announcement. And also wanted to thank very much Cynthia Johansson, the CEO of the BC Colleges of Nurses and Midwives, and also Aman Grewal, the BC Nurses Union representative who's here today, because it's my understanding that we wouldn't be here today without the support and encouragement that both of you have brought and the leadership that you've brought to this and working with Minister Dix. So thank you so much for that. And also, certainly last but not least, the reason for the season and the announcement here, we have Jenny and Monique, both internationally trained nurses who are living examples of the commitment to nursing and service to British Columbians, and the remarkable gifts and talents that they bring to our province. I wanted to say thank you so much for joining us today and for speaking about your experiences. We're all here today with a shared goal and a common goal. We want to make sure that every British Columbian gets the health services that they need, and it's as simple as that. It's a key focus of my plan for the first 100 days in office, and as we start a new year, we remain focused. I remain focused on delivering those results that people can see and feel and touch and experience in their lives. Within the first 50 days, British Columbians saw us take action on public safety, making communities safer by tackling those repeat offenders, those violent offenders, making sure that they remain in custody and off the streets. We're tackling the housing crisis, opening up units for rent that were previously barred from rental by unfair rules, making sure that families can stay in their homes and not be evicted by unfair rules. And we're making sure that our public healthcare system remains strong today and for generations to come. We're building new hospitals, opening new urgent primary care centers. We're building the first new medical school in generations in Western Canada, delivering a new compensation deal for doctors, bringing 4,600 healthcare workers back into the public sector and hiring thousands of nurses. But we need to do more. Hiring and training more nurses is part of our own ongoing work to make sure that healthcare is accessible to all British Columbians. And still, we know the demand for the skills and expertise that nurses bring to the job every day has never been more in demand in our healthcare system. There are high-skilled and experienced nurses who want to get to work in our system now, but are facing barriers preventing them from delivering the services that British Columbians need. We need to fix that. Just as we made changes for internationally trained doctors, we need to do the same for nurses. And that's why we're here today. I'm pleased to announce new supports in a faster assessment pathway that will get more nurses working in BC's healthcare system faster. For nurses returning to practice, there will be help with the costs of re-entering the workforce. These are nurses who may have taken a break for practice for any number of reasons and want to come back but are facing financial or other barriers to coming back. We want to support them in coming back to work. This includes application and assessment fee support, along with travel expenses support. Additionally, bursaries of up to $10,000 available for any additional education that those nurses need who are coming back to practice in order to be able to get to work. For internationally trained nurses, we've committed $1.3 million to set up a new pathway to streamline the licensing process. This will help our partners, the BC College of Nurses and Midwives, and the Nursing Community Assessment Service assess more applications faster. Now, what is that going to mean in real terms for British Columbians? Well, right now, candidates in this scenario are waiting 3 years to be granted registration. Our goal is to bring it down with these reforms to between 4 to 9 months. We also want to reduce any potential financial barriers. So we had grants for internationally educated nurses, but those nurses had to pay those grants up front and then be reimbursed later. So now our government will be covering over $3,700 up front in application and assessment fees for internationally trained nurses, so that application fee does not stand in the way of them practicing in British Columbia. The bottom line is this: whether a nurse was trained in our province or not, we're ready to welcome those who are ready to care for British Columbians. Today's announcement continues our ongoing work to support more internationally educated nurses in British Columbia. Some numbers: since April 2022, a total of 5,500 nurses have said that they want to work in BC. 2,000 are in the registration and assessment process right now. More than 90% of applications were received after our government's initial actions to welcome internationally educated nurses into our healthcare system. There is still much work ahead of us, but I'm optimistic about the impact that these changes will have in a very real way for British Columbians. Now, I know that there are some who believe the way to fix our healthcare system is to abandon the principles of universal access to Medicare. They believe that the wealthiest should be able to buy their way to the front of the line, thinking that that somehow solves the line. It doesn't. It just changes who's at the front of the line. We can't cut funding and expect more doctors and nurses to show up. British Columbians couldn't afford that old approach to healthcare 5 years ago when they changed governments, and they sure can't afford it now. Everyone in BC deserves the absolute best in healthcare, no matter where you live or how much money you have in your bank account. That's my vision for British Columbia, and I know it's British Columbians' vision for how our province should work. A province where you can build a good life and know your family is taken care of. Thank you.
Thank you very much, Premier, and I think this is a significant day. It builds on the steps that the government took in April that have had an enormous impact, a positive impact on allowing and involving internationally educated nurses in British Columbia. It's something that is widely supported by the public, and it demonstrates the determination of all of the partners in healthcare. And you see many of them here today. Our College of Nurses and Midwives, which has been doing exceptional work, Canadian leading work in terms of removing barriers to people coming and practicing their skills in British Columbia. And our our BC Nurses Union, which strongly supports investment in public health care and strongly supports these actions and welcoming new members of the BC Nurses Union, but also, I think, and importantly, supporting those nurses when they get there, as we need to do in our workplaces across British Columbia, which is always a challenge and always an important consideration. So I want to thank all of you, and now I want to share the floor with my colleague, Harvinder Sandhu, the MLA for Vernon-Monashee, a nurse, and the Parliamentary Secretary for Senior Services and Long-Term Care, to say a few words. Harvinder? And Floyd, wait a second.
Oh, thank you. So kind of you. Thank you. I always wish I was a couple inches taller, but this does it. So, hello everyone. Thank you so much, Minister Dix, for a warm welcome. Good afternoon, everyone. So good to see you all. I would like to acknowledge with respect that we are able to gather here today on the traditional territories of Musqueam, Squamish, and Tsleil-Waututh nations. It is such a pleasure to have an occasion like this and to share the floor for the first time. I want to acknowledge my colleague, my friend, Susie Chant, MLA from North Vancouver Seymour, who has been also a registered nurse for decades, I think more than 3 decades, and Susie still works as a nurse on casual basis. And it's incredible to have another nurse on the government side. So when we're shaping the policies, doing the work, it's really encouraging to see the support of government. I also like to, Susie Chant, MLA Chant, is also a Parliamentary Secretary for Accessibilities. I also would like to acknowledge my colleague, Mabel Almore, MLA from Vancouver, Kensington, and previous Parliamentary Secretary for Senior Services and Long-Term Care, who has done phenomenal work and advocacy to support nurses, internationally educated nurses, and healthcare workers in general. In fact, when I went to the legislature in Chambers in April 2014, I was MLA Mabel Almore's guest advocating for internationally educated nurses. We were in the opposition then, but we have the support ever since from the BC NDP government. So that is how I met, and now we sit next to each other in the legislature. So who knew? It's incredible to be here. I want to acknowledge my sister, fellow colleague Aman Grewal, President of BC Nurses Union, and Cynthia Johannesson, CEO of BC College of Registered Nurses and Midwives, and our guest speakers, Monique and Janine. Thank you so much for being here today. Today's announcement has a great meaning for me. Before entering into public life, I had the honor of serving as a registered nurse for almost nearly 2 decades in BC, first in Terrace and then Vernon, so the riding of Vernon-Monashee, which I represent. I am also an internationally educated nurse. And at the time, people, when asked me, when I made my way to become patient care coordinator, and a lot of people asked me, oh, this is really encouraging to see you doing such a good job. I said, don't ask me how I got here. It took me many years and several years and many tears, but now we're changing that. We're changing that for the good. So, you know, working in Northern Health Authority in rural communities, and then later in the Okanagan, working in various healthcare settings from acute care to community to long-term, I got to meet many, many people from different walks of lives, also to meet with many healthcare workers. Every day, my colleagues, the nurses of British Columbia, take care of their patients with great skills, compassion, and knowledge. While they deliver care with precision, they also embody a sense of hope and possibility, which make the demanding work of healthcare meaningful. 3 years of pandemic have presented unprecedented challenges for most people, but our nurses and all our healthcare workers, they continue to work undeterred and with so much hope and possibility and, you know, the positivity. They deliver excellent care every single day despite the challenges they have been facing. Nurses also face life decisions too, and some of them have chosen left nursing to pursue other goals. But when given the opportunity to do this rewarding work, we need to support them. They say once a nurse is always a nurse. we may take leave or we may retire, but once we become nurses, nobody can take that nurse out of us. And that is why we're gathered here today. As you heard from our Premier, we are going to support Canadian-trained nurses in BC who want to return to practice by removing some financial barriers. This will help them to get reassessed and trained faster so they can contribute to the public health service more quickly. This step our government takes is incredible, significant, and most direct. By supporting our nurses, more patients in British Columbia will benefit. I am also proud that our province has one of the most diverse populations in Canada, and there are many reasons internationally educated nurses may want to work here. The financial support we're announcing today for internationally educated nurses to help for them to gain accreditation quickly will be more reasons why they will choose British Columbia. Besides, it is a beautiful province and it also has a wonderful, diverse population. We have a great healthcare system that value and respect nurses, a system that is equitable and accessible for all British Columbians. These value-added incentives are important factors to new Canadians as they build their lives in our province. By streamlining the registration process, and by providing bursaries for skill upgrades, internationally educated nurses can now work in their trained professions faster. Moving to a different country is difficult as it is, but knowing that the government is here to set us up for success, we will in return build a stronger BC together. As a nurse, it is reassuring, and I'm sure my MLA, Chad, my colleague, can attest to that. It is incredibly reassuring to have a government, to have health minister who works sincerely and have premier and government. We've seen them working diligently with sincerity, with the dedication, not only to support healthcare workers, but also to strengthen our healthcare system in general. And before I welcome Minister Dix back to the podium, I would like to say that this is my first opportunity to speak an event as the Parliamentary Secretary for Senior Services and Long-Term Care. It is truly an honor to have this start in company of you, Minister Dix, and my colleagues and guest speakers, and all of you. I would like to say thank you so much for making this day so special and letting me be part of this. Thank you, Mr. Dix.
Well, there we go. Thank you. That was great. Thank you, Harvinder, and thank you for sharing the unique perspective you bring to this work. As you know, over the last couple of years, Mabel Elmore has done this work and really worked on this question of both of accreditation, but also of internationally educated nurses in particular. And you're picking up on that, and your extraordinary experience really assists in that. So thank you very much. And I want to now introduce one of the many partners in our work in healthcare, the president of the BC Nurses Union, Aman Gurwal. Aman?
I'm thinking I may need it. Thank you.
Good work. Hands up.
Oh, this one. So thank you very much. I'd like to begin by sharing my respect for the traditional and unceded lands of the Squamish, Musqueam, and Tsleil-Waututh peoples of the Coast Salish Nations, lands on which we are gathered here today. As president of the BC Nurses Union, representing more than 48,000 nurses in this province, I am pleased to be here alongside Premier Eby, Minister Dix, and our fellow nursing professionals. Thank you so much for being here. Today's announcement of investments in supporting both internationally educated nurses and those interested in returning to practice offers hope for a strained and understaffed healthcare system. For years, BC Nurses Union has been advocating for improvements to help streamline the application process for IENs, internationally educated nurses, and the BC Nurses Union welcomes this as a promising step forward. We believe these internationally educated and trained nurses, professionals, bring valuable experiences, skills, and knowledge to a healthcare system that is in desperate need of nurses. We are optimistic that the efforts to remove barriers for not only the internationally educated nurses, but also those interested in returning to practice will provide meaningful supports for these nurses who are eager to provide patient care in our province. Not only will the addition of these nurses alleviate some of the pressure on the current state of our staffing crisis, the diversity that Harwinder was speaking about and the experiences that they bring will help to serve the cultural needs of our patient populations throughout the healthcare system. While much work remains when it comes to addressing the nursing shortage in this province, these initiatives announced today are very positive steps in the right direction. And I just want to say that we look forward to working with all parties to welcome these nurses into the workforce and here into BC. So thank you.
Thank you very much, Alman, and thank you for all the work and all the work of nurses. And, you know, we reflect on the last 3 years, but you can reflect on the last few weeks. We in BC, as you know, had a very serious accident with the bus, and the response of the healthcare system, it was unbelievably tragic circumstances for everybody involved. And the response on Christmas Eve of doctors and nurses and health sciences professionals and healthcare workers and, of course, ambulance paramedics to that accident demonstrates it's profoundly moving to see after all 3 years of pandemic and everything else, that response was remarkable on the ground, and it reflects, I think, the work of nurses everywhere. So I know we all understand that in theory, and we all understand that every day is a challenging day, but also when you're dealing with people who need help and need to get well, but also this has been a particularly challenging period, and we are very grateful for the work of nurses across BC. I want to say this announcement today and the work we've been doing couldn't be possible without our partners at the BC College of Nurses and Midwives, and their partners, such as the leadership here at Langara College and everyone here at Langara College who is part of that partnership. We're honored today to have with us Mark Heldman, who's the VP Academic of Langara College, and Yusuf Farachia, who's the VP of External Relations and Community Engagement. Thank them for their help today, but also their help every day in making the work we're doing and we're announcing today a reality and make a difference for individuals, allow them to achieve their professional aspirations, but as well for our healthcare system as well. So, and I'm sure Cynthia would agree with that. It's my pleasure and honor to introduce the CEO of the BC College of Nurses and Midwives, Cynthia Johansson, to say a few words. You get a step.
Thank you. Thank you, Minister Dix. It's an absolute pleasure and delight to be here. But before I start my remarks, I just want to acknowledge that we are gathered here today at Snow-Way-Latham, which is also Langara College. That's the Musqueam name that has been given to this amazing center of learning. It's also on the unceded and traditional territory of the Hunkaninam-speaking Musqueam. I am grateful to the First Nations people of this province who for thousands of years have looked after and protected these lands. The BC College of Nurses and Midwives regulates more than 68,000 individuals. Currently, 6,308 of them are internationally educated nurses. We know the journey to securing a career in the health professions can be more challenging for those who are new to our country. The new registration process announced today aims to reduce the time it takes to become registered by increasing efficiency, reducing costs, and focusing on the most important elements that will allow an individual to demonstrate their ability to practice competently and safely in British Columbia's strained healthcare system. For many years, the college has been working with the Nursing Community Assessment Service, and my colleague Rita Parikh is here today. The service aims to develop and implement, and has developed and implemented, a performance-based assessment process that allows internationally educated nurses to show us what they know, what they can do, and how prepared they are to work in our current healthcare system. Over time, as a regulator, we've moved away from spending time reviewing documentation describing an applicant's educational credential and experience. And even though that is important, it is not the sole contributor to their skills as a nurse. The new NCAS triple track assessment and our new improved IEN pathway application process is the culmination of significant efforts to challenge the status quo. We want to help applicants to gain registration in the right nursing role as quickly as possible, ensuring that the time that it takes for them to enter our country and gain good, reasonable employment is significantly reduced. And as you heard the Premier say, it's taking up to 3 years for individuals to get through the process now. That's not acceptable. We aim to reduce this to 4 to 9 months. I want to thank, in particular, the staff at the college and at the Nursing Community Assessment Service who have strived to find more innovative ways to look at an applicant's skills and experiences and to match them with the needs of our healthcare system, and doing so without compromising public safety. I also want to thank the staff at the Ministry of Health and Minister Dix for their ongoing support in our efforts to consider new, innovative, and modernized ways to regulate in the public interest. And most importantly, I want to thank those applicants who choose to engage with our college and who choose to pursue a career as a nurse in British Columbia. You, Jenny, Monique, bring value to our healthcare system, not only by the virtue of the career path you have chosen, but through the lived experiences and the care that you will bring to the patients and families and communities you serve. Thank you very much.
In a little bit here. How's that? Thank you very much, Cynthia. Obviously, we're proud to continue our collaboration with the college, and I wanted to note that announcement that we made in April, which we talked about some of the progress today and how we're building on that progress. We announced the consolidating the provincial-based assessment processes for IEN candidates. We offered approximately $9 million in bursaries to help with assessment fees. And we created new nurse navigator positions to help internationally educated nurses navigate the assessment and licensing process. And building on that, the work has continued, and the steps taken today build on that success and seek to achieve even faster success. I'm pleased that other jurisdictions in the country have followed us in that regard. And sometimes I get asked when they announce their changes, whether we're doing them in BC. It turns out we did them in BC, and that they're following us, which is great that we're doing that work, all of us together. And at that announcement was Jenny Arsenault, and I've already hyped you up a little bit, Jenny. I'm not putting any pressure on you at all here, but as remarkable, I think, as Jenny's presentation was that day, is the work that she does every day for patients in BC. And so I'm really honored to introduce Jenny Arsenault again.
Thank you, Minister Dix. I'm honored to be here today. The last time I was here was when I took my NCAS assessment. My name is Jenny Arsenault, and I am an internationally educated nurse from the Philippines. I've been working as a registered nurse in Campbell River for more than 3 years now. I love working and I love British Columbia, but it was a journey to get here. In 2009, I graduated from Cebu Doctors University. I went on to work as a registered nurse in a hospital in the Philippines for 5 years. Moving to another country was a lifelong dream because nurses are not treated well and not fairly compensated in the Philippines. In 2016, I landed in Richmond on a student visa. I was 4 months pregnant and my husband was way back in the Philippines. I knew that I would have to study to practice nursing here, but I didn't expect to have to take several exams and pay a lot of money. I was pregnant throughout my studies and gave birth in BC Women's Hospital alone. I brought my baby to the Philippines to meet his father and extended family, then made the difficult decision to leave him there at the age of 4 months to return to Canada to complete the process of becoming a nurse. It took me 1.5 years to get my LPN license and 3 years to obtain my registered nurse license. And that costed me $40,000 in assessment, registration, and tuition fees. After my experience, I knew I wanted to make it easier and more affordable to other internationally educated nurses to fulfill their dreams of working in BC. In October 2022, I was invited by Rita Parik of the Nursing Community Assessment Service, or NCAS, to their very first staff retreat. During the session, we discussed the whole process as to how stressful the exam and the long wait was and how everything could be improved. I later joined an NCAS focus group that was working to improve the whole process and the website and the whole experience, how we could all easily find the information that we need as an internationally educated nurse. Clearly, NCAS wanted to understand how they could make the process better for internationally educated nurses. NCAS then worked with the government to make it all happen. I'm so excited that this day has now come. No more secrets. The new process will be much easier and faster for IENs. Rather than taking up to 3 years to get registered, it might take a year or less than a year or so. Having the registration and NCAS assessment fees waived will also be a big help, as it's already very expensive to move to BC from another country. These changes show that the BC government values and supports internationally educated nurses. I know these changes will inspire more IENs to come to BC and start a fulfilling new chapter in their lives. Last 2018, my husband joined me in BC and we are now both permanent residents. In 2019, we had a second son. My kids are now 4 and 6 and they're both Canadian citizens. And my family loves BC. We love the beaches, mountains, and islands that we get to explore. Both of our children have the initials BC to represent our love for this province, namely Brandon Clark and Blaze Cassidy. We're all so grateful to be here, and I'm particularly grateful to be here doing what I love, caring for my people in the community. So many internationally educated nurses will benefit from these changes, and so many British Columbians will benefit from having more caring nurses at their bedsides. I want to thank NCAS, BCCNM, Health Match BC, and the government of BC for their never-ending support for internationally educated nurses. I can assure you that you'll be happy that you did. Thank you.
Thank you, Jenny, and thanks for caring for patients in Campbell River, and what an incredible story. I share your excitements about our progress to help more internationally educated nurses ready to practice nursing in BC, and I'm glad to see you here and many, many more like you. Like Jenny, our last speaker is also an internationally educated nurse. Please welcome registered nurse Monique Wee to the platform. Monique.
Thank you, Minister Dix. It is an incredible honor to be standing here and be part of this very exciting announcement. My name is Monique Wee, and I'm an internationally educated nurse from the Philippines. I now work at BC Children's Hospital since 2019. With BC easing the pathway for IENs like me, I am very excited to know that I will be working with more internationally educated nurses. My journey to becoming one was not easy at all. After starting my career in Philippines, I worked in Saudi Arabia and New Zealand, and specializing in pediatric emergency. In 2017, me and my husband decided to finally live together in Canada. While I was in New Zealand, I started the grueling process to become a registered nurse here in BC, thinking that it might be lengthy and exhausting. Sure enough, by the time I got here, I still hadn't completed the requirements. While I waited, I worked in reception and other jobs. Fortunately, I stumbled upon the BC government's Career Path for Skilled Immigrants program. They provided a lot of educational programs and gave me about $2,000 for educational expenses, which was helpful. I thought that would be enough to cover everything, but I ended up spending more than 10 grand just to get my license converted. I had to complete online courses, clinical programs, and finally sat the NCLEX, or the National Council Licensure Examination. Waiting was really frustrating, but I did not give up. Finally, on May 22nd, 2019, I became a full-fledged Canadian RN. However, the challenges continued after getting my license. It was very difficult to get a job because I really wanted to work in the hospital. I was so close to really going back to New Zealand when the manager at BC Children's Emergency Department finally offered me a full-time line. It took me 2 years to become a nurse here, while it only took me 6 to 8 weeks to get my license converted in New Zealand. And in Saudi, I only had to sit their council exam. The whole process here was lengthy, exhausting, and expensive. The changes announced today, along with the changes announced in April, will make a world of difference to IENs. Actually, in the unit I work now, I am the only IEN. However, a lot of our clerks, our care aides, were all nurses back in their home countries. They're amazing, they're helpful, they're very hardworking, and they're very, very capable of being nurses here. I can't wait to tell them this news, and everyone is going to be very, very excited. Even though the process to become a nurse in BC was by far the hardest of all the places I've worked, BC has been my favorite place to be a nurse. I just also love BC in general. It's beautiful and it's a very welcoming place. My husband and I now have a son, and we're grateful to have the opportunity to raise him here. The changes to the IEN assessment and registration process will give even more IENs the opportunity to establish lives here too. This will benefit everyone in British Columbia because more nurses means better healthcare. These changes show that the BC government values the education and experiences of IENs. To my fellow IENs, this is it. Finally, our voices are being heard. I am so excited to be working with you soon, and thank you for not giving up. And of course, I'm incredibly grateful to the BC government for this new pathway for IENs. We will not fail you. Thank you.
You don't need this, right? Okay. Thank you very much. This is another significant day in our efforts to build and to put in place a health human resources plan that meets the needs of our public health care system into the future. Over the past number of months, we've added hundreds, in fact, more than 600 new nursing spaces in BC colleges and universities. We've added 335 health sciences places in BC colleges and universities. We've created new pathways for internationally educated doctors, internationally educated nurses. Our HCAP program has added thousands of people to the long-term care and home support system in BC, and there is more work to be done and work that we will continue to do, including a new SFU medical school, including 128 new places for doctors at the University of British Columbia. In short, this is a comprehensive response, And we need, and we have the partners in place who support these initiatives to do it. You can see that today with the support of our team in the NDP caucus, which has strong representation of nurses. You see it in terms of the support and the work by the BC College of Nurses and Midwives, by the BC Nurses Union, and by nurses across British Columbia who support these initiatives even as they do the remarkable work that nurses do every day in our healthcare system. So we're very honored, very excited about today's announcement. That ends the announcement. We're now going to take questions from the media, and I'm going to invite Premier Eby back to the podium. Premier.
Thank you for listening to today's episode, and just one more word of thought. It would seem that especially in sciences, that education is education. Law and business degrees may slightly vary with this, but the rules of science and human anatomy do not change from country to country. So why is it that we have such a problem with accepting international degrees in sciences and medicine when nothing is going to change? It's going to be the same education, the same work, the same course loads, because it's all the same, universal to our planet. Maybe our governments need to decide to open up their policies so that all those with science degrees will be welcome to work within Canada. And the same thing also applies to the United States, that policies need to be opened up so no matter where you have been educated in science, that you are welcome to work within that country. Again, thank you for listening to us today, and please do click on that subscribe button wherever you may find it so that you can get continued updates from us here at Depictions Media Radio and on Policy and Rights. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.